Now. All right. Everybody see that?
Mm-hmm.
Okay.
Yeah.
So MDMA, which is 3,4-methylene dioxymethamphetamine, which is why we call it MDMA, because that's a mouthful, right? Also commonly called ecstasy or Molly. Someone sent me an article this morning that was so good about how with psychedelics, we all want the ecstasy, but sometimes there's the agony that comes along with it. So we're going to talk more about the ecstasy part, but we know healing from trauma has the light and dark side. So this is for education purposes only, information. It's not medical advice. You guys, most of you know me. I've been a nurse practitioner for a long time, over 30 years now. So I've had a lot of experience in this world. And even though I'm pretty excited about MDMA, I want to just say it is not a magic bullet. There's no magic bullet, but it is a really powerful tool that I'm pretty excited about. And so I'm going to share some of my own experience with it. I'm going to share some of the research. I'm going to talk about the chemistry, how it works, how it creates the experience that it creates, and talk about how it relates to trauma. All right. So set to be approved by the FDA for treatment-resistant post-traumatic stress disorder in 2024. I don't know if that's going to be early 2024 or late. I've been following this for a while, and it was supposed to be approved in 22, and then it got moved to 23, but I'm pretty sure it's going to happen in 2024. It's looking good. And it is kind of lumped into the world of psychedelics, but it is not really a psychedelic. It's classified as an empathogen or an entactogen, which I will talk a little bit about what those mean. But it has a very strong stimulant properties. And even though it's not been above the ground FDA approved, there has been a very strong underground movement of therapists using MDMA for individual and couples and trauma ever since it came into their knowledge base. So that's been since the 70s. And you don't have to raise your hand, but some of you may have used it recreationally, and I'm not going to call anybody out for that. But so this may or may not be new to you. So, and if you've used it recreationally, you may be a little bit like, oh, how is this going to work for PTSD, and how does that work? So we'll talk about that. So I'm going to talk about my own personal story with it and how it's affected me, and talk a little bit about the empathogen and entactogen aspects. So I grew up in the 70s, the height of the war on drugs, just say no. So I did not smoke marijuana or do drugs in college or any of that. But about 5 years ago, I became aware of psilocybin and the positive impact that that can have, and had a really good response to that, was able to make some progress with my trauma response, and be able to come off of antidepressants for the first time in my adult life. So I became pretty excited and open to what these non-ordinary states of consciousness can bring. And in 2020, I sought out a retired psychiatrist in Salt Lake City, Utah, and had my first MDMA experience. And it was really powerful. I was able to go back and revisit some memories that I had not been able to really revisit, even in talk therapy. And not just that, but I was able to it was almost like I was able to walk through and be with my younger self. And this aspect of the entactogen, which for me is like, I was actually able to touch into my innocence that I had at the time of some of these events, and the strength that I had. And what PTSD can cause is an inability to kind of reconnect with that innocence, and also the inability to be present to the strength that's there. We get very aware and present to the fear and the anxiety and maybe the vulnerability, but not the strength. that we had during the time of the trauma, whatever that was. My second MDMA experience happened later that year when I hosted that provider, and we had 14 people that went through an experience, and I had a couple session during that, and also was able to remember some things. And one of the most significant things that came from that experience is I had a traumatic experience when I was 17, right before I turned 17. And for 30 some years, I had been telling people that I tried to commit suicide a year later. During that experience, I remembered that it was only 3 weeks later. And so like, that's what can happen during trauma, is memories are not accurate, and memories about what happened and memories about who we were and what was going on were not accurate. So being able to make that connection for me allowed me to understand myself and the patterns in relationships and so many things in a much deeper way. And, you know, part of trauma is suppression of memories and inability to, you know, to recollect things. And also, I really touched into my strength at that point. I was able to, and I'll talk about the pharmacology of it and why I think that that's the case, that the stimulant methamphetamine aspect of it what it creates in the body is part of why I think it works so well. And then I've had a few more, I won't go into the details of MDMA sessions. It's continuing to work on mostly patterns in relationships, patterns of relating, which I think that's what trauma causes most of the problems with, is problems with relating and going into patterns that aren't working. So if you are anything like me, you find yourself kind of complaining a lot about things in your relationships, and then either continuing to stay in them and not being able to change your pattern, or you leave that relationship and get into another one and find yourself doing the same thing over again. So that is kind of an inability to shift out of a pattern or learn a new way of being. And that is often the result of trauma, that in the ability to learn to respond in a different way and to be resilient is lost. And so, okay, I'm going to talk a little bit about the history of it. So MDMA was actually first developed in 1912, a long time ago. And it was developed by a company named Merck, and they were trying to find a medicine that would help to control bleeding. So it didn't work very well for that, but some therapists got their hands on it in the 70s and started using it in therapy. And they noticed that in the therapeutic environment, people were much more open. They were able to get to be less defensive. They were able to talk about things in a different way. They were able to remember things, and things that were prior to that just making no progress in therapy, they were able to make progress. And it was very effective for couples, because one of the biggest things for couples is getting locked into defensiveness and fear, and fear in the intimate relationship coming up, and then getting locked into position and not making any progress. Also, around in the late 70s, early 80s, some young people, mostly young people, said, hey, guess what? This stuff is really fun. Let's take it and go to a party. So raves, electronic dance music, it was all part of the scene. And unfortunately, some people overdid it and got into trouble, and there were some deaths. And so the FDA stopped in and said, this is bad. It's got to be made illegal. So that happened in the early 80s. And right about the same time, Rick Doblin, who's been the champion of MAPS, of getting this, he's been the one for over 30 years trying to get this back and legalized. He started MAPS and started doing the research. So kind of paralleling right along with that is when the research started. But so fortunately, there have been no deaths or serious injuries when used clinically. So it's not something we have to worry about. But the therapeutic underground is alive and well. It's just at the Psychedelic Science Conference in Denver in June. How many people were there, Dawn? 12,000?
Yeah, I think it was 13,000 people.
Yeah, a lot of people were there, and a lot of these people are not the people who've been doing the research on the above ground. They have been, and most of them were, as you can imagine, from the West Coast. It seems to be where all the fun stuff happens. But they, so two of the bigger people in that movement was a guy named Shulgin. Last name is Shulgin. He's written some really good books about it. But he called MDMA window. That was his nickname for it, because he said it allowed you to see things more clearly, see through the window, see your experience differently. And then another fella who was pretty famous for training people, he started using it in 1977, and he trained over 4,000 therapists in how to use MDMA. And he called it Atom because he felt like it restored people to this primordial state, or this state of innocence. And I can say from my own experience that that is really I think one of the most powerful aspects of this is actually feeling that experience of innocence that trauma can take away. So I want to talk about the chemistry. How am I doing on time? Doing okay. Of MDMA. It is quite the neurotransmitter hormone cocktail, which is why it has such a profound effect. So people have decreased feelings of fear, defensiveness, increased sense of well-being. They feel more sociable, more extroverted, more sexually aroused. So this is why it became so popular to take some of this and go to a party and have fun. You're dancing and having a good time. You're very sociable. You feel connected. So especially with someone with social anxiety, this was pretty awesome. So serotonin, which we are all pretty familiar with because almost all antidepressants affect serotonin, but it is a neurotransmitter, so it's a chemical messenger, and it impacts the sense of feeling calm, safe. It's like a happy neurotransmitter or calm neurotransmitter. About 90% of the serotonin receptors are actually in the gut, which is why one of the side effects with MDMA can be some digestive symptoms. But almost all antidepressants have some impact on serotonin. Next, dopamine. So dopamine is the pleasure chemical. So it actually is in a large part responsible for motivation and learning, because it makes learning something pleasurable, and that's good for our survival. So when you're doing something pleasurable, your brain releases dopamine, and this is also a big part of the biochemistry of addiction, and it's part of the reward system. And so it also acts as a hormone, and it affects flow to your kidneys, and it affects your heart. So it does a lot in your body, which is also one of the reasons why some of the side effects with MDMA can come up. And it's involved with cognition, attention, sleep, arousal, learning, and it also has an impact on lactation, breastfeeding. And so it is also involved, not in a big part, but in a small way, with the fight or flight response. So this is part of why with MDMA, you can feel a little bit like you felt during an experience of trauma, which is you feel some sense of danger or excitement or hyper alertness. And so that's not bad, but it's almost like recreating in a safe, secure way the experience of what it felt like when the trauma was happening. And also it can actually cause you to feel euphoric. So I think that all of the neurotransmitters and the hormones that this affect can affect this feeling of euphoria, which was, why we call it ecstasy. But dopamine is probably one of the stronger aspects of that. So people that have dopamine, they feel happy, motivated, alert, focused. If they don't have enough, they feel unmotivated, unhappy, just kind of like not wanting to do anything. So this is a pretty powerful chemical messenger. The other one that MDMA affects is norepinephrine, or noradrenaline. People talk about adrenaline junkies, having a lot of adrenaline, the stress response. And interestingly enough, a lot of times people with trauma will seek out, they'll be kind of thrill seekers, either directly or indirectly. When I became a nurse, I didn't want to work anywhere but the cardiac intensive care unit because I wanted my patients to be on the edge. If they weren't on the edge, I wasn't really interested. That's what I wanted. So that thrill-seeking behavior, statistically, a lot of people who end up being emergency room nurses, intensive care nurses, and police officers, they like adrenaline. They like to be near that. They like the excitement. So it causes an increase in heart rate. It really is a big part of the fight or flight response. Arousal, attention. So it makes you very focused. It's very exciting. And so if you just think about what that feels like for you, you'll have a sense of that fight or flight response, which none of us can be there all the time. And if you're in that all the time, it's really hard on the nervous system. But one of the things that happens pretty early in the MDMA experience is your pupils get huge. Right. So your pupils are huge because you want to be aware, alert, you're taking in more information, and you're getting more oxygen to your heart speeds up. So this was one of my first MDMA experience. The first thing I noticed was my heart was beating faster and I did not like it. So it's a little bit like that. I'm about ready to get on a roller coaster. I'm kind of excited feeling, and can be pleasant or unpleasant, just depending on, that's why you're the set and the setting is so important. And the other things, fight or flight gets all the attention with stress response, but we also have a freeze response, and then we can have the fawn response. And the fawning is when we become over accommodating. And it's but it's all for survival. So whatever your personality is and whatever the situation is going to determine which one of these things that you do. And so there is a lot going on, right? So adding that to the mix, we got some oxytocin. So oxytocin is the cuddle hormone or the bonding hormone. It's what moms are producing when they hold their babies. When you're hugging someone, when you're with someone, it's produced during orgasm. So that feeling that you get, you feel really calm and relaxed and connected, right? So that's also being produced. So there's a lot, right, going on with the chemistry of this. So it's produced during uterine contractions and breastfeeding, we know, but there's a lot of other things. But it's bonding. It's a bonding hormone. And for many people with trauma, they have trouble bonding. And there's some confusion and there's some adaptive learning that has happened. Some people call it trauma bonding, which explains why people can get into abusive relationships over and over and over again, because there is something there, there's something learned, and there's some bonding there. And then we got prolactin. So prolactin is a hormone with over 300 physiological effects. So I'm certainly not going to cover them all right now, but it is part of the hypothalamic pituitary adrenal axis stress response. It's involved with learning, development, bonding, connections, making new nerve cells. So there is a lot happening here. So coming back, there's a lot happening in the MDMA experience, which is why it's so powerful when it's used appropriately and in the right set and setting. The other thing that's happening as a result of all this change in your chemistry is that the amygdala gets much quieter. So the amygdala is this little tiny almond-shaped thing in the middle of your brain. It's part of the limbic system, part of the stress response system, and it is always looking for danger in the environment. And so if you're always scanning for what's the expression on the people's faces, what are their words, what are their body language, what's going on, how are they moving towards you. And so during the MDMA experience, this is much quieter, which is why people are able to have conversations without going right into that, I'm in danger, I'm assuming my position of defense because I'm in danger. A little bit about PTSD and complex PTSD. You know, we talked a little bit at the beginning about what's going on in Israel right now. And like, so we know things like trauma, big traumas, big T, like war, a natural disaster, a bad accident. What most people that I see and work with are dealing with is complex PTSD. So that is more about being in abusive relationships, being around someone with addiction, child abuse, child neglect, those kinds of things. And that ends up with all kinds of unmet needs, like really basic childhood needs, and then all these patterns of relating. And so, you know, we can think of like flashbacks, hypervigilance, things about traumatic events. But with complex PTSD, people have trouble with emotional regulation, their sense of self, relationships are just chronically difficult, and then addictive and dependence symptoms that you can have. So, you know, I'm going through some of it. This is, I feel like each one of these topics I could talk for 2 hours on, so I'm rushing through a lot here. Gabor Mate, I think, has done a really, really nice job of talking about just these basic attachment needs and authenticity needs that we have, and how if we don't have these, that's actually traumatic, and then that sets us up for a trauma response. So I think understanding it intellectually is really good and nice. It doesn't get us all the way where we need to go, but it's the beginning of that. So, but MDMA does allow for us to have a lot more empathy for why. I know for myself, I've had a lot of frustration with myself. Like, I feel like I'm somewhat intelligent. Why do I do so many dumb things? But when I can see like, oh, there's trauma here, and these are patterns that were set up really early, it helps with compassion. Okay, so I want to talk a little bit about side effects during the MDMA experience. So increased heart rate, already mentioned. Blurred vision, the vision changes, the pupils get really huge, but this is like right just during the experience. Can upset the stomach. A lot of that has to do with, you know, when we're in that fight or flight or stress response, many people have stomach symptoms, right? Your appetite is shut down, or you might feel like you feel a little nauseous, or you have some diarrhea. Jaw clenching. I'm actually not sure what part of maybe it's the amphetamine aspect, probably is. It just creates a little bit of like weirdness in the jaw during the peak of the experience. It does have an addiction potential because of the euphoric aspect and the stimulant aspect. The day of the MDMA experience, if it's used too late in the day, you're probably not going to get much sleep. And one of the other, the two of the other things, and this has happened for me, but it's supposed to be less, you know, in the clinical setting, is it does kind of deplete your neurotransmitters, your serotonin, dopamine, norepinephrine. And so it can lead to, just for a couple of days, of feeling kind of flat. And it's just something to be aware of, because if you know what it is, many people with trauma also suffer with depression. So if you know, hey, I'm going to feel a little flat for a couple of days, you don't freak out about it. As you expected. So I'm going to talk a little bit about the MAPS protocol, since they've been the one doing the most above the ground research. And what that is, it is 12 weeks at least. Sometimes it goes to 16 weeks. It is 3 8-hour MDMA sessions with 2 licensed professionals. And those sessions are they're 3 to 5 weeks apart. So with that, you're prepared, you're working with people that you're familiar with. Most of the time, these sessions start early in the day. You get a dose of MDMA, and then within an hour or so, you get a second dose of MDMA if you're not all the way fully in the experience. And then the day lasts about 8 hours. And they just finished their phase 3 trials. I had some statistics here. So 88% of the participants with severe PTSD experienced clinically significant reduction in PTSD diagnostic scores, and that lasted for, they were looking at them for up to 2 months after their experience. And that was compared to 60% with the placebo, remembering that the placebo people were also getting 12 weeks of therapy. So even the placebo group, they were not getting the MDMA, but they were getting 12 weeks of therapy, which, you know, I want to say this again, MDMA is not some magic bullet, take this, your trauma's gone. It is used therapeutically with trained, good therapists who understand trauma, and that is its effect. So plenty of people have taken MDMA and gone to a rave concert, and they still have a lot of trauma that's not healed, and it actually can create more trauma if someone's in a setting and, I don't know, you know, trusting people they shouldn't be trusting, and things can happen. So bad things have happened and trauma has happened with MDMA. So I just wanted to put that in there. But MDMA assisted therapy, I mean, the whole idea is to get people to have a bigger, you know, better, more expanded life, because what trauma does is it makes your life smaller and smaller and smaller. So then the big aspect of the therapy that's preparing and after is about integration. So that is whatever comes up. And I have to say, after my first MDMA, I did not have the right preparation and I did not have the right integration. That was my bad. I wasn't, well, I won't say anything more about that, but it wasn't ideal. I still got a lot out of it, but it could have been a lot better. In retrospect, now that I've had a better experience, that it could have been a lot better. But integration can look like a lot of different things. Some people use art, some people use different types of therapy. But it's absolutely essential to get the benefits, the therapeutic benefits of MDMA. The lasting improvements are not going to be experienced without therapy, without preparation and the integration in a therapeutic way, and ongoing support. And you know, one of the things that I do is I have an integration group, and we meet twice a month, and then I know Dawn has an integration group. So it's not, you know, that one-on-one therapy is great, but also having some kind of group or community of people who are doing similar work and understand what's going on. So memories, what I've experienced with this is memories can continue to come. I realize we're going long on time, so I'm almost done with this part. Memories can continue to pop up even weeks, months after an MDMA experience, which is another reason why having therapeutic support is really important and valuable for people to help someone to help you make sense of how this connects to your present moment, present day things. So who is not a good candidate for MDMA? So as I said already, that there have been no deaths or serious injuries with MDMA in the clinical trials. The deaths that have happened have been with people using MDMA recreationally, mostly to do with hyperthermia, getting too hot, being in a rave, getting too hot, and having all this, you know, this is a very powerful chemistry happening in your body. And with your fight or flight response, it changes how your body handles fluids. There's a lot that can happen there. So acute renal failure, brain edema, cardiac arrhythmias. So this is what can happen if it's not used appropriately. Not to scare you, but just say this is a very powerful substance. If you are on certain medicines, you do not want to use MDMA. So MAOIs, which impact a lot of neurotransmitters, antiretroviral medicines. Those are like the things that some people are on for HIV. You don't want to be drinking with MDMA or using a stimulant. If you happen to have like ADHD and you take a stimulant, you just don't take it the day of your MDMA experience. So that's all about that. And then if you have heart disease, so it will increase your heart rate. So if you have, oh, I hate that feature. Like when I raise my hand, it looks like I'm raising my hand. Let's put it down. All right, I'm just gonna leave it there. If you have heart disease, then unmanaged high blood pressure. So if you have high blood pressure, you're on medicine, it's managed, it's fine. But if you have unstable angina, like, and you can't walk around the block without having chest pain, you don't want to take something that's going to increase your heart rate and your blood pressure. You just wouldn't want to do that. Just like that person probably wouldn't want to get on a roller coaster at Carowinds, because it's not a good idea to increase your fight or flight response. Liver disease, if you have uncontrolled seizures, as I said, malignant hyperthermia, I don't even know anybody who walks around with that. Of course, if you're pregnant or lactating, if you have a diagnosed psychotic disorder, or you have bipolar disorder. That's a little bit tough, because I think many people who have improperly diagnosed and treated trauma end up getting labeled as having bipolar disorder, and it's actually trauma. But certainly if you're dealing with mania and acting out, you wouldn't want to. So accessibility. So it's estimated that the MAPS protocol, which, as I laid it out, it's 12 weeks of therapy with 3 8-hour MDMA sessions with 2 licensed professionals. It's going to be about $15,000 or more. Not sure, might be more. And it's not going to be available until later, probably 2024. Hopefully, so will be. And it's not known who will cover it, but I know you will need to have a diagnosis of treatment-resistant PTSD, which that is typically you've failed talk therapy and you have failed at least 3 medications. And that's usually what qualifies you for being treatment-resistant. And yeah, I don't know how that's going to go, how that's going to go down. So I'm going to stop the recording. Well, let me just put this in the recording, because I'll say more about this. So if you're interested in knowing more about this, you can reach out to me. I'm going to put a link in the chat about this for more information. And also, if you want to know more about the membership, you can reach out to me about that. So I'm going to stop sharing my screen. Stop.